Today I've got an intriguing topic. It's about people jumping to solutions before they understand the problem. So should we dive in? Let's go for it. We've all been there, haven't we? When something's wrong, we want it fixed.
Fix it for me.
And fast. But here's a question. How can we fix something if we're not entirely sure what the problem is? I'd like to share a story about one of our members, who we shall call Mike. Mike reached out about his friend's painful injury. The friend wanted to find the right treatment, but had no idea what was actually causing the problem.
I don't really know what I'm doing.
And this reminds me of many wonderful clients who come to the clinic hoping for a quick fix, sometimes after months of enduring a problem. And we don't mind that, it's okay. But I once had a client, we'll call her Jane, who came in with an 8-month-old pelvic problem. Despite having many treatments and from lots of therapists, the pain had only got worse. And it's a scenario that we're seeing more and more often, unfortunately. But here's the thing, to get better faster, you need to know what you're dealing with. It sounds simple, but it's a step so many skip. Using Jane's case as an example, after a thorough examination and taking a good clinical history, we realised that something crucial had been overlooked in their previous consultations.
Oh, bugger.
That's why at our clinic we put a premium on the time taken for a full history, an orthopaedic and chiropractic examination. And with Jane, we also used the diagnostic ultrasound imaging to improve diagnostic accuracy as well, because I'm a sonographer too. After battling through pain for 8 months, we were able to refer them to a consultant who booked Jane in for an emergency hip replacement that very week. So it just shows she wasted 8 months when she really needed to go in for surgery straight away. It was a horrendous, awful situation, but just happy that we were able to help and put things right for her.
Well, thank goodness for that.
But going back to Mike's friend and anyone in a similar situation, here's what you need to consider. So first of all, identify the cause. You wouldn't start a journey without knowing your destination, would you?
No, that's a bad idea.
And the same goes for injuries and physical problems as well. Knowing what you're dealing with first is extremely important. Number 2 is to consult the right professionals. Seek out primary healthcare professionals trained in diagnosing problems. This is the difference between a clinician and a therapist. For example, a massage therapist is not trained to diagnose problems, but they are excellent at treating problems within their area of expertise. The more precise the diagnosis, the more efficient your recovery path is going to be. And number 3 is to ask questions. There's no such thing as a silly question in our office. The more you understand your problem, the better your chances of effective treatment and prevention in the future. Our bodies are smarter than we give them credit for. No one taught us how to limp, did they?
Did you see the memo about this?
It's our body's way of dealing with a problem. If we try to override it, it will remind us why that's a bad idea.
Pain.
So listen to your body and follow its cues. But in conclusion, whether it's Mike's friend or any of us out there, don't rush into treatment without understanding the issue. And to the clinicians and therapists, remember it's okay to refer to someone else when you need to. That's the mark of true professionalism, is knowing your scope of practice and what's inside it and what's outside of it. But if you'd like to learn more, you're very welcome to join our online community membership to answer your health questions and also provide you with up-to-date cutting-edge resources, all designed to help you make consistent progress on your health journey. We've put the links in the description and also in the show notes for you. But thanks for listening, and we'll see you in the next episode. See you soon. Bye-bye.